I want you all to think about the last time you were on your phone, on social media, scrolling through, relaxing. Ponder, did you come across a piece of health content that sounded something like, lose X number of pounds in 30 days? It gets better. Here is one way to prevent cancer. Even better. Someone standing in a supermarket, holding a packet of food, saying, this is going to kill you. Now, how many of you can confidently say that you knew whether that piece of health information was scientifically accurate or not? My name is Dr. Idrees Mughal. I'm a medical doctor from the UK. I have a master's degree in nutritional research, and I'm certified in lifestyle medicine. And I want you to consider the fact that we are currently living in the age of information. You can access the internet instantly in just a few clicks. So many devices in our daily lives are hooked up to the internet. Our mobile devices, tablets, TVs, watches, and even some glasses now all have access to the internet. This is tremendous. This has tremendous utility and benefit for humans. Not only do we have access to a wide, vast array of information we've never had access to before, but it allows us to look at a diversity of perspectives which can aid us in making well-rounded decisions regarding our health. Not just that, but if you've been suffering with a unique, rare issue, whether it's health, medical related, you can now access community support groups everywhere online, right? This was never the case before. So it helps individuals to go through their health journey no longer in isolation. These are all tremendous benefits of online health information now. So it's no surprise that in the UK, over the last decade or so, the amount of individuals that are actively seeking out their health advice from online sources is going up. It's now over 60%. That's the majority of us. And the trend is only increasing. That being said, despite all of these benefits of this wide, vast amount of health information now, there are, of course, its challenges and potential harms. There was a study done last year by Dublin City University that analyzed over 67,000 TikTok videos. You know what they found? Just 2% was scientifically accurate. That is so alarming, we should all be seriously concerned. Not only can it affect our physical health, which is pretty obvious, but it also has lasting mental health impacts. Did you know that 9% of American adults are estimated to have an eating disorder at some point in their life? That's over 30 million Americans. In the US, over the span of just 4 years, the number of health visits related to eating disorders more than doubled amongst people under the age of 17. And social media use now in the literature for at least a decade has been strongly associated with an increased concerns related to eating. The more you use social media, the higher those concerns are. There are also long-term health impacts of misinformation online. Not only do we have the physical and the mental public health risks, but there's also the issue that health misinformation can undermine the health efforts of public health institutes, medical professionals, which can lead to widespread mistrust in science-backed public health policies. Not to mention the economic burden of disease and the loss of productivity due to illness. I came across a fantastic quote at a recent lifestyle medicine conference in the UK, which I think perfectly summarizes the problem we have today. It's called the information paradox. We are overwhelmed by information, but can't find the information we need when we need it. I can't tell you how many thousands of messages I get every single month of people, genuinely concerned, real people, telling me, Dr. Idrees, is this correct? What do I do? Should I implement this piece of advice? Dr. Idrees, what about this video? It's extremely concerning that in an era where we have access to the most information we've ever had in human history, why are people becoming more confused about their health? Simply put, I believe, it's because it's extremely difficult to decipher what's actually correct and what's not, right? So, that's exactly what I'm speaking about today. Let's dissect some health claims. But even if you know nothing about the individual specific claim being made, we can look at their style of communication to give us a better idea as to whether what they're saying is reliable or unreliable. So we're going to follow with a few video clips, short video clips, and we're going to discuss some key elements of their communication style which can give you a better idea as to what might be reliable or not. Video clip number 1.
Here are the top 5 foods that cause inflammation. Number 1 is corn. And corn, most of it here in North America is genetically modified. It does have a pesticide residue because they use glyphosate. That's a whole other issue. Number 2 is canola oil. We know that this is a polyunsaturated fatty acid, a PUFA, very inflammatory, and it is highly refined.
So, what is the problem with what she's saying there? If you recall, the first thing she said was, these are the top 5 foods that cause inflammation. She used the word top on purpose. This is an example of an absolute statement. Words like top, most, best, worst, least, these are actually, within the health sphere, very unscientific words, because there will never be a top healthy food for all individuals of a population. This doesn't take into account individual differences in needs, medical conditions, history, or responses or effectiveness of different interventions for everyone. A more sensible science communicator would use phrases like, could potentially, perhaps, maybe, is associated with. Be careful for that one. No one who is truly evidence-based, and you won't see it in the medical literature either. No one in the medical literature, research, academic field would use words like most, best, worst, least, top. Let's look at example number 2.
I've done the carnivore diet for 322 days. These are the most shocking results I've experienced. You would think your farts would be rancid. They're not. Oh, protein farts, protein farts. Yeah, it's a lie. Fiber makes you fart. I'm not joking. I almost never fart. It is very rare that I pass gas. Same with burping. Unless you're drinking a carbonated beverage, you don't burp. Acid reflux. I never have heartburn, which is weird. I thought meat was the culprit. For me, it was sugar.
So, regardless of him talking about burps and farts, let's just brush past that. The point of the clip here is that he is saying the carnivore diet is healthy because I now no longer burp, I now no longer fart. For me, sugar was the issue. What is the problem with that? This is an over-reliance on anecdote over evidence. Why is that a problem? Personal anecdotes or personal experiences are of course beneficial. They're useful to know. Researchers use personal anecdote to go and conduct research studies. That's how we form hypotheses, right? But if you're trying to advise people to change their life, you can't use personal anecdotes because you can't control the confounding variables. How do you know if their benefits that they're telling you are from the thing they're mentioning or from a change in sleep quality, a change in stress levels, a change in work-life balance, a change in physical activity levels, or the 100 other things they possibly cannot account for as an n=1 study, right? Not only that, there's the issue of selective reporting. People are more likely to share positive outcomes. Look at social media. Social media is one big highlight reel of everyone's lives, right? People show you their best holiday pictures and take 50 pictures and choose the best one. The health sphere online is actually not so different. If someone has a successful weight loss story, if someone has a successful, I'm now in remission for my diabetes, right? My symptoms are now gone. I'm now the healthiest, strongest I've ever been. However, if that same diet caused someone to have raging diarrhea every day, skin outbreaks, and abdominal pain, they're probably not going to shout about it online. Just a thought. This can skew public perception because failed cases or moderate outcomes might not be frequently discussed. So you only see the benefits. You don't see the negatives. There's also the issue of misattribution of cause. People often attribute positive change in health to the most noticeable change they made, even if the improvement was due to something else. So, whilst personal anecdote can of course be very useful for you as an individual, effective health advice should ideally be grounded in scientific evidence that is reproducible, peer-reviewed, and considers the broad variability in human health outcomes. So remember that. Let's go to another video.
The healthcare industry doesn't want you to know this. So watch till the end because I'm about to let you in on a huge secret. You've been led to believe that eating too much cholesterol will block your arteries. Even when you search it online, it says that too much cholesterol will lead to plaque in your arteries and increase your risk of heart disease.
Okay, I think we can all guess what the problem here is. He's framing himself as some sort of expert that has hidden secret knowledge that big pharma, big government, big broccoli, big whatever industry doesn't want you to know. But he has the answers, right? I like to call it this us versus them narrative, us versus them mentality. This is a very smart marketing tactic, and I'll explain why. Not only does it undermine trust in established health authorities, the ones that make public health guidance for you to live your lives, it also leads to behavioral changes because people are more likely to engage in unscientific health behaviors if they think it's been hidden from you, right? If they think it's secret, no one knows about it yet. For some reason, it becomes more acceptable then. Also, it could result in people delaying to seek effective health interventions from medical professionals. There's also the polarization of ideas. You see this often online, where people come together around completely divergent health views, and they will all confirm each other's bias in the comment section. Oh yes, you're so right. You'll find an anti-science echo chamber, and you'll find a pro-science echo chamber. And they don't cross paths. They're just all telling each other how happy they are for each other, and they never, being someone that debunks health information online, I see this a lot, and it's quite scary to see. So people that rely on an us versus them narrative, you can be 99% sure they're talking out their ass, quite frankly. Video 5.
When you eat natural foods like this, you become free. You become who you are meant to be.
Okay. Whilst intuitively this advice sounds pretty reasonable, right? Eat natural food, you be the healthiest version of yourself. Okay. Whilst it does seem sensible, seems like common sense, why is it a problem? Because this is a logical fallacy called the appeal to nature fallacy. This is the idea that just because something is natural, therefore it is good or healthy, and just because something is artificial or synthetic, that means it's bad. The issue with this is, it falls on its face very, very quickly. Here are some things that are natural, that are indeed harmful. Parasites, very natural within food. You find them in meat all the time, right? Are you now going to argue to me that parasites are healthy for you because they're natural? I would hope not. Mold on food. Mold is a perfectly natural process. Nothing wrong with it. Does that mean it's healthy? Yeah, I'll let you decide. arsenic, heavy metals naturally found within soil, water systems, are you now going to consume a concentrated amount of arsenic? Please don't. Deadly nightshade, one of many plant species that would kill you if you consume it. All naturally grown, by the way. On the flip side, there are many artificial or synthetic things that are made in the lab that are actually very good for humans. Just look at one example, the fortification of food. We take one nutrient, iron. We have an abundance of research now that just the iron fortification of food drastically reduces the incidence of iron deficiency anemia by over 50%. That's just one nutrient. 100 years ago, if you were diagnosed with type 1 diabetes, you would have a 90% chance of dying within 5 years. Now, since we have made synthetic, chemical, man-made insulin in a lab using recombinant DNA technology, the life expectancy for type 1 diabetics now is over 60 years. That is a tremendous public health success. Artificial. Plenty of other examples exist. The replacement of sugary sweetened beverages with low-calorie beverages, artificial sweeteners as we call them. Iodized salt is not found in nature, but it's significantly reduced iodine deficiency and iodine deficiency disorders in many countries that have been tested. Then you have an abundance of evidence-based supplements that are synthetically made, like creatine monohydrate, vitamin D, whey protein, just to name a few. So, people that rely on the appeal to nature fallacy to conclude that something is healthy, they need to bring more to the table. That's not a strong enough argument. I think this is my last example here.
You see this container right here? This is the beginning of all of America's health problems. You see, in 1911, Procter & Gamble invented Crisco as an alternative to cooking with tallow and lard. They took toxic waste seed oils and hydrogenated them and then made Crisco.
This one I find exceptionally funny because he is literally blaming the introduction of one food, seed oils, for the cause of all of America's health problems. Every single one. Obesity, heart disease, fatty liver disease, you name it, right? He blames a single factor for the rise in chronic disease. In this example, seed oils cause obesity. This is a massive oversimplification of literally any health issue. Let's take obesity, for example. Obesity arises from a complex combination of biological, psychological, socio-environmental factors that all impact energy balance and fat accumulation in unique ways. Just look at the obesity foresight map, which is a complex interweb of all of the factors that influence obesity rates. You've got issues to do with food production, food consumption, accessibility, societal influences, individual psychology, human biology. The list goes on and on. So if someone is trying to get you to buy into their narrative by claiming that a single thing caused any chronic disease, they're chatting waffle. Don't listen to it. You don't even need to know about the thing they're talking about. Just scroll on. You know it's nonsense, right? So let's recap. The majority of adults now look to online sources for their health advice. Health misinformation causes real and lasting damage to physical, mental health, and also affects consumer decisions every day. But how can we tell what's reliable or not reliable, even if we know nothing about the specific claim being made? That's where you look out for patterns in their messaging. Do they use absolute statements? Do they rely on anecdote over actual evidence data? Do they provide or are they telling you an us versus them narrative? Are they appealing to nature or other logical fallacies? And do they blame disease on a single factor? There are many more tips and tricks that I could have given you, but I hope just these few will now allow you to decipher fact from fiction. Thank you.